Effective Delegation and Supervision by Danae Haynes. Delegation. What is it? Delegation is a legal and management concept that involves assessment, planning, intervention, and evaluation. It is defined by the American Nurses Association, the ANA, as the transfer of responsibility for the performance of an activity from one individual to another while retaining accountability for the outcome. So although an RN is able to have someone perform a task for them, they are still ultimately responsible for the overall outcome of the patient's care. What can be delegated? The Nurse Practice Act provides the legal authority for nursing practice, including delegation. However, the criteria differs in each state and are often not clearly spelled out in the Act. There is no clear-cut list of do's and don'ts when it comes to delegation. Safe delegation practices. You should know your patient. Never delegate before the initial assessment. Know who you're delegating to and what level of training they completed. Know the task. Explain the task and expected outcomes. Supervise or be available to answer any questions, and always follow up and evaluate your patient. Supervision. Supervision is defined by the ANA as the active process of directing, guiding, and influencing the outcome of an individual's performance of a task. When you delegate a task, you must be available to supervise or answer any questions if needed, and be able to go evaluate your patient afterwards. There's 3 different types of supervisions. You have unsupervised. That's when an RN is working with another RN. Both are responsible for their own work. Initial direction and or periodic inspection. RN supervises a licensed or non-licensed caregiver. They've been working together a while. The RN knows their training and has a working relationship with the unlicensed caregiver. Continuous supervision is needed whenever you have a new working relationship or the caregiver is needing very frequent assistance. The BSN Essentials. This links to the basic organizational and systems leadership for quality care and patient safety, effective communication and collaboration among healthcare professionals is imperative to providing patient-centered care. Teamwork among healthcare professionals is associated with delivering high quality and safe patient care. And it also links to the interprofessional communication and collaboration for improving patient health outcomes. In accordance to the BSN Essentials, the BSN graduate is able to implement safety principles and works with others on the interprofessional healthcare team to create a safe, caring environment. BSN graduates will be able to work with organizational and community areas to provide care themselves and or supervise care provided by other licensed and non-licensed staff. QSENS, Quality and Safety Education for Nurses. Teamwork and collaboration. You have to be able to function effectively within nursing and interprofessional teams, fostering open communications, mutual respect, and shared decision-making to achieve quality patient care. And you need to value your other team members and what they're thinking. Patient-centered care. You need to be able to communicate your patient's values, preferences, and express needs to other members of the healthcare team. Communicate care provided and needed at each transition. Value continuous improvement of own communication and conflict resolution skills. References.